Welcome to our deep dive on homelessness policy. To start, let's clarify what exactly are tent cities and why are they suddenly so visible across urban America?
Tent cities are clusters of tents or makeshift shelters set up by people experiencing homelessness, often in parks or vacant lots. Their emergence is linked to a shortage of affordable housing, crowded shelters, and restrictive rules like curfews or sobriety requirements.
Some cities have begun recognizing these encampments while others treat them as illegal. Could you explain the difference between sanctioned and unsanctioned tent cities?
Absolutely. Sanctioned tent cities are approved by local governments and may offer portable toilets or security, aiming for a safer environment. Unsanctioned sites, on the other hand, are typically subject to sweeps and eviction, lacking basic services.
Let's shift to the underlying causes. The housing affordability crisis seems central. How have rent and home prices outpaced wages to drive this issue?
Since 2010, average rents in major metros have risen over 60%, while median wages grew by only 20%. This gap means even full-time workers can't secure stable housing, pushing more people toward homelessness.
Are there specific examples or cities where this mismatch is most stark?
Certainly, in Los Angeles, the average rent for a one-bedroom apartment is over $200-300, but minimum wage earners make less than $200-400 monthly before taxes. That leaves little for food or health care, let alone savings.
Another key factor is mental health and addiction. How do gaps in treatment contribute to the growth of tent cities?
Roughly one-third of unhoused individuals report untreated mental illness or substance use disorders. With limited access to affordable care, many end up cycling between streets, ERs, and jail-tent cities, often become their last resort.
That's a sobering reality. Are there models that have successfully addressed these service gaps?
Yes, cities like Houston have integrated mental health outreach into housing programs, reducing chronic homelessness by 54% over a decade. But these approaches require sustained investment and political will, which is now under threat.
Recently, federal policy has shifted from housing first to a treatment first approach. Can you walk us through what these models entail and why this change is significant?
Housing First prioritizes rapid placement into permanent housing, then offers voluntary services. Treatment First, now championed by the current administration, requires individuals to undergo addiction or mental health treatment before accessing stable housing.
What have studies shown about the effectiveness of these models?
Decades of research, including a 2018 HUD study, show Housing First reduces street homelessness and hospitalizations. Treatment First often leads to more barriers people drop out or are excluded if they can't comply with strict requirements.
Legal frameworks have also changed dramatically. How did the 2025 Supreme Court decision in Johnson v. Grants pass alter the landscape for homeless individuals?
That ruling allowed cities to ban sleeping outdoors with tents or blankets, even when shelter beds are unavailable. This legal shift essentially criminalizes the basic act of seeking shelter, making tent city sweeps far more frequent and punitive.
Could you compare this to previous legal standards?
Before this, courts often ruled that punishing people for unavoidable conduct like sleeping outside was unconstitutional. Now, enforcement tools are broader, but critics argue this worsens human suffering without solving root causes.
Let's walk through the recent timeline. How have federal and local actions shaped the rise of tent cities from 2019 to today?
In 2019, the Trump administration criticized Housing First. Tent cities expanded rapidly from 2020 to 2024 as homelessness spiked. By 2025, executive orders dismantled Housing First, HUD cut rental assistance, and over 150 cities banned outdoor sleeping.
Are these policies unique to the current administration or part of a broader trend?
While the recent acceleration is notable, the roots go back decades. Shrinking federal housing investment and increasingly punitive local ordinances have compounded the crisis over time.
Let's break down these policies using strategic frameworks. Looking at SWOT, what are the main strengths and weaknesses of the tent city approach?
A key strength is increased visibility. Homelessness can no longer be ignored. There's also a focus on veterans and mental health. But weaknesses include deep HUD cuts and abandoning Housing First, an evidence-backed model.
How about opportunities and threats under this framework?
Opportunities exist in centralizing services, but threats loom: legal challenges, public backlash, and a likely surge in homelessness due to funding gaps.
Let's expand our lens with a pestle analysis. Politically, what's driving these shifts, and what economic factors play a role?
Politically, the Supreme Court and Project 2025 have greenlit aggressive policy changes. Economically, inflation and rent hikes are pushing more people into homelessness, while budget cuts destabilize vital programs.
Social and environmental impacts are often overlooked. Could you elaborate?
Tent cities can segregate and stigmatize, deepening social divides. Environmentally, dense encampments disrupt parks and waterways, prompting complaints from residents and city officials alike.
Stakeholder interests are complex. Who are the main players, and what hurdles do they face according to the sharp analysis?
Key stakeholders include the Trump administration, HUD, local governments, advocacy groups, and the homeless themselves. Hurdles range from legal challenges over forced relocation to funding gaps and public backlash.
What actions and results have we seen so far?
Actions include building tent cities, encampment sweeps, and HUD restructuring. The result is paradoxical. Homelessness is more visible, but conditions worsen without systemic investment in housing.
Finally, let's use the SPEAR framework. What's the current policy execution strategy, and what critiques are emerging?
The core strategy is a shift to treatment first, enforced by executive orders cutting HUD and DEI programs while mandating tent cities. Encampment sweeps and forced relocations are common. Critics say this approach dehumanizes the vulnerable and fails to address root causes.
Are there reform proposals or alternative visions gaining traction?
Advocates are pushing for affordable housing expansion, wraparound services, and evidence-based models. Without these, most experts predict homelessness will only worsen, despite increased visibility and tough enforcement.